Welcome back to Stay at Home, Taking Care of Elderly Parents. In this module, we take everything that you have learned so far in all of the modules, and we translate it to the idea of what happens when elderly parents cannot continue to stay home. How do you look for a care community? How do you work with care staff, whether they are still working in the home or whether you have moved your parent to a care community? How do you put it all together, and how do you make it work out? I'm Pamela D Wilson, caregiving expert, advocate, and speaker. I am your host. I am your presenter for this program. Let's continue, as we always do, with the housekeeping. As you know, I substitute the term elderly parent or elderly parents for the person for whom you are taking care of. The outline for this module is in the course materials. The slides are there. Please do print them out and follow along with me. In this module, we are combining the activities that caregivers do and caregiver goals, your goals, with the activities that elderly parents do and their goals. Plus, we're going to talk about working with a care system that is guided by regulations and constraints and that has different goals. The difference or the gap in these goals, the measures of progress, the expectations, and the standards of satisfaction between family and care systems is what can result in frustration and perception by family that providers don't care. And also a similar perception from the care system that patients and families don't follow through and they have difficult personalities. At the end of navigating care, you should be able to identify the skills that support working with care systems. You should be able to gain consensus for care expectations, coordinate activities, and manage care projects for elderly parents. In this part, we're going to talk about specifically expectations, parameters, and constraints. So by the end of this, you should be able to formulate a plan to ensure clear communication, identify steps to manage projects, and implement processes that help you coordinate care. In this module, we'll talk about the outside of the family care partners that you will probably interact with. And we'll also discuss the process to avoid potential things that I know happen that can occur every step of the way when you are coordinating and managing care for your elderly parents. Anytime you add a service, add another person, add a support to a care situation, this increases the complexity and the possibility of errors. If you've ever heard that saying, there are too many cooks in the kitchen, you know that this means that multiple people may be trying to control or influence a project, with every person in that group having a different idea of the expected outcome or how that meal is likely to turn out. Let's talk about expectations. When two people or a team of people come together, each person has a different expectation about the outcome of the relationship, the way that people should behave, and results. You've probably seen this in the workplace, or if you work on teams, maybe you're on a sports team outside of work, or you're on a committee or a community project, you can see that everybody is working together, but sometimes we're not all on the same page. Expectations are based on prior results, parameters, and constraints. In caring for elderly parents, conflicts arise within the family between elderly parents and the primary caregiver, your brothers and sisters, and then outside of the family, conflicts arise between consumers and care systems. If you've had conflict within your family, it's easy to relate the idea of how one brother and one sister may have a totally different idea about how to care for mom or dad, even though the idea is we're all here to care for mom or dad. So let's talk about some examples. For the caregiver, you may want mom or dad to be more physically active because you know now the benefits to health. Mom or dad are on board, they agree to start exercising, but soon those days of exercising, they fall off. You are upset because mom or dad committed to exercise, and now, surprise, they are not following through. Where's the gap? How do we figure that out? We have to start asking questions. And with elderly parents, especially asking questions, you don't want to be accusatory or patronizing because that will not help the situation. We've learned that by now. So to get to that gap, let's say that you meet with mom or dad and you're talking about progress. You're asking questions. Mom or dad tell you that they're bored because they don't want to do the same exercises every day. They're not seeing progress after a week and they're not feeling better. How do you respond? I know sometimes we might want to yell or scream or throw a tantrum, but that doesn't work. And we also know that seeing progress takes time. Just because we start to exercise a week later, we're probably not going to see results. So if you think of teamwork in the workplace, how can you relate this conversation with your elderly parents to a situation? Let's say that you're an employee. Your boss comes to you to ask why you're not getting your work done. Or you might be that supervisor who has to figure out why one of your employees isn't getting the job done. How many of you have been in this situation on one side or another? What did you do to work out the issue? When both sides willingly come to the table and they're committed to arrive at a solution, we know this. We know there's a greater likelihood of managing that gap, whether it's gap in communication or process or expectations. Rather than being the employee who sits and says nothing, in a perfect world, you let your supervisor know what you need to do the job. Is it more training? Is it better instructions? Is it more communication? Is it a different schedule? Ask yourself, what will it take to improve and get the job done? And then on the other hand, as the supervisor, what can you do? Can you provide more clear instructions, better timelines or deadlines? Maybe find another employee that this employee can serve with as a training partner. If you focus on the idea of creating a solution as a team, as two partners, you can do the same with elderly parents. So on both sides, your parents and yourself want to be asking questions to say, what can we do differently? What can we do better? Because if you keep doing the same thing, you will get that same result. You know that mom and dad are willing to do this. They've told you that. But they are struggling with learning new habits and new routines. Even though they agree that physical exercise is a really good idea, it's hard for them. They also don't want to disappoint you, much like you as the caregiver, through all of these situations, have had to learn new habits. You've had to change routines in your life, had to be more flexible, talk to supervisors about time off from work to care for elderly parents, make adjustments in your family. Everybody in these care situations are continually adjusting, and that's what is so important to remember, and also the degree of flexibility that this does require. So back to the exercise. So your elderly parents don't want to disappoint you, but they didn't say anything. They were hoping that you didn't notice. And now you've got a situation where they agreed, they're not exercising, you know the importance, and you have to figure this out. So you just want to go through the questions and the situation that we talked about. And really, this does apply to all situations in life. Let's look at the idea of sharing expectations and asking questions. The example of mom and dad becoming more physically active is an example of how expectations easily go off track. Issues that result in unmet expectations include poor communication or directions, a lack of a system for feedback, different meanings attributed to words or goals based on a person's past experience, parameters or constraints, and the idea of context. Context means that circumstances form from setting situations or ideas, and how people understand that context is different. And I'll share an example in a moment. It's essential to realize that words or statements mean different things to different people, and always to restate or reconfirm what is said verbally or in writing to avoid confusion. All of our personal styles, our experience, our habits, They are so different. By having a process to reconfirm and identify communication styles, to ask questions, present information, confirm expectations, and gather ongoing feedback, we can create systems and processes to make sure that everybody is working toward the same outcome. Consider the aspects of a process that targets the result that you want and try it out. If there's a glitch, review the process, adjust, give it another try, and do that as many times as it takes until you have a system that works consistently. And I'll share an example. Over the years, I've trained many employees in working with care systems exactly the way that we are talking about in this module. It does take a bit of being willing to look at yourself. Look at your habits, the way that you communicate, the way that you interact with other people, and to try to figure out if there's something that you are doing that is taking the project or taking the goal off track. I had an employee who was a great employee. She was smart, she was bright, experienced. We would have conversations and I would lay out expectations and say, okay, these are the 5 things we want to get done. 1, 2, 3, 4, 5. Are we good? Yes. She would go away. And then we would come back together and those 5 things, maybe 2 of them would be done, 3 of them would be kind of done, but not all the way done. And I realized that I may not have been explaining things well. So I started to ask this employee to restate to me what she heard so that we could figure out where the gap was between me asking her to do something and the outcome, much like the situation with elderly parents and exercise. And what we realized was she was trying to figure out the context of what I was asking her to do and if there were things that I didn't say. I'm a very direct person. I don't beat around the bush. There's no hidden agenda when I supervise someone or when I ask somebody to do something. It's pretty much 1, 2, 3, 4, 5. This is what we want. Are we good? Let's go get it done. She would look for what I didn't say. So she would spend a lot of time ruminating about, okay, I was asked to go talk to someone in a care community about this. What else am I supposed to do? You know, is there something else that I wasn't told to do? And this was a lot from her relationship with past supervisors who didn't give her thorough instructions or who maybe gave her an instruction and then changed course in the middle of that communication, which does happen in the workplace. So what we learned was I would have her repeat back to me what I asked her to do. And that solved the issue. Because many times she would repeat back to me something that wasn't what I asked her to do, and I could narrow the expectation. It is so important in all conversations to have those, I call them teach backs, but have those back and forth conversations about this is what the goal is. Everybody give me your understanding of what the goal is and where we're trying to get and the timelines and what your role is in exactly to get us there. Even having conversations with people about the meaning of words may sound silly, but it's important. I may say setting boundaries, which we'll talk about in this module, and setting boundaries may mean something different to you. Many times when I'm now having conversations with people, they will say something, maybe a word, and maybe they say, I know that I need to get this done in an expeditious manner. And I'll say, well, what exactly does expeditious mean to you? And I'll share what it means to me. Important, because when you are working with care staff in in-home caregiving companies, home health, care communities, hospitals, everybody has a different interpretation of those meanings. And to avoid situations that go off track in the care of elderly parents, you really want to take extra steps to reconfirm understandings, reconfirm goals, reconfirm everything involved in these situations, because you want the care that you want to get for elderly parents. You don't want to have issues with it going off track. So we'll continue with this discussion. Let's talk about setting parameters. This is very, very important. A parameter defines how a system or process works. And I'll give you an example. So for an example, when I was a care manager, one of the projects I did was to help clients find a good match in an assisted living community for a parent. My conversation with my clients, with their children, started out by looking at parameters because I wanted to have everybody agree on a specific set of conditions or guidelines that we were going to work within, so that there was no misunderstanding, so that there was no expectation that I was going to come back to them with a different recommendation. The parameters were cost. What was the monthly budget of my client, and for how long, for how many years could they afford to pay this much per month? Next, it was the location in town. So Denver is a big city. So I had them give me north, south, east, west boundaries. It was a street or it was a highway. Next was the size of the room. If you have toured any assisted living communities, you know that these rooms are not big. Some of them are 600 square feet. If you want to pay quite a bit more, you can get a larger suite, maybe 800 square feet or 1,200 square feet. And that is a shock to somebody who's moving from a home that may be 2,000 square feet or a large home that's 4,000 square feet. Next, we talked in detail about the type of care needed. And I always requested medical records because most children in these situations, and even the parents, couldn't give me an accurate health picture of their parents, and sometimes couldn't even accurately describe the help needed. If I met with the adult children separately, I always went to meet with the parents so that I could do a personal assessment and talk to them about their care needs, so that I could watch them get up out of a chair, talk to them about what they could or couldn't do every day. Then I always asked about estate planning documents and talked about the fact that, is money going to run out? Because like in our past discussion, if that was going to be a reality, those were conversations that I wanted to have with the care community, because my goal was to find a community that these clients could stay at for years so that they would not have any surprises and so that they wouldn't have to move again. I always continued to ask more questions. And then what I would do is I would agree that through this process, I would send them updates, and I always gave them a timeline. I would say, based on this project, it's going to take me 3 weeks. I will take these parameters, find out available communities, get the rates to you, go out and tour, meet with the staff, and I'll come back to you with 4 recommendations. But if I run into a snag in the middle, I will be back. I will update you every week so you are not out there wondering what I'm doing and if I'm working on this project. So the process of talking about parameters is a really good way to avoid glitches in expectations. A leader or a team sets parameters by asking questions. We encourage learning. We encourage teamwork, cooperation. We always want to give feedback and updates about where we are. Make sure that we are following the deadlines that we agreed to. Talking about expectations, gathering more information, being proactive, and making sure that everybody has steps so that they can succeed. Part of learning to identify parameters, as you'll see, it comes with experience and from working with other people, from asking questions, and there's always a final question to ask. Can anybody guess what that is? We have to ask ourselves, is there anything that we haven't considered or discussed that might cause this plan not to work out the way that we expect? And when you ask the question, sometimes you do come up with, oh, we didn't think about this, or we didn't think about that, or at least you recognize that something might happen, but that right now you have enough information. And if anybody on that team, if anything changes, those guidelines, you agree that you are going to talk about it and share it within that team. Going back to the exercise with elderly parents and the idea of exercise, If you do this, this would have resulted in your parents calling to say, exercise is boring. We don't like it. We need a meeting to talk about this. We're willing to do it, but this is not working out for us. Let's talk about what we can do so that we can get the goal accomplished. And the same thing with you. If you agree to do something for someone, don't just let it slide. Be proactive, be honest, be upfront, and say, I thought I could do this. I can't. I need help. It's not working out. We need a different plan. Don't ever leave anybody hanging, especially in care situations, because it will cause problems. Let's talk about constraints, because constraints are other ideas that can affect projects. So a constraint is something that puts a limit or a restriction or prevents something from happening. And a constraint may be a rule, a regulation, a law, or a process that sets a limit on a plan. When you begin to work with home health care companies that are regulated by state laws, by government laws, hospitals, care communities, you will come into a place where there are constraints that you have to figure how to work around. So a simple example of a constraint is we have 24 hours in a day. If you estimate a project and it is going to take more than 24 hours a day, you either have to extend the time or find a way to make that project more effective. Another example is you have a 5-foot by 5-foot room and you have an 8-foot dining room table that won't fit. What do? Get a different table size if you want to use that room, or figure out something else. Those are the ways that we have to be flexible. And the way that you figure out the aspect that you can change, which may be yourself, the way that you respond, is through asking questions and through going through the process that we talked about. So, summary for navigating care services, communities, and providers. The components of expectations, parameters, and constraints support accurate communication, and it helps us define results when we are working with care partner teams, as you can see. As the primary caregiver, you may be that power of attorney. You are the advocate for the care of an elderly parent within your family and with care partners outside the family. By learning to improve communication and social skills, you will improve care for your elderly parents. And as I always say, everything that you learn in life, whether it is at work, you can translate it to caregiving situations. And in caregiving situations, you can translate a lot of this to work, even to your personal life. Everything that we learn, and this is my personal belief, offers us opportunities to benefit ourselves in other areas of life and to improve. There will be many situations in caregiving where you will feel like you are lost and frustrated and you can't go on and you're bumping up against a wall and it is not working. Rather than being frustrated with yourselves, look for the lesson in that. Sometimes a delay or an unexpected turn of events turns out to be a blessing in disguise when we look back at that situation a week later or a couple weeks later. I do believe that everything happens for a reason, but we have to be proactive and make things work out. We cannot wait for the sky to drop solutions in our lap for elderly parents. It doesn't work that way. We have to be proactive and we have to look at ourselves and the way that we respond to situations and to change our responses so that we can get the results that we want. I'm Pamela D Wilson, caregiving expert, advocate, and speaker. Thank you so much for joining me for this webinar. We will continue with the next webinar that will help us learn how to continue to establish relationships and manage care with care providers. I'll see you again soon.